Hello, everyone. Good morning. I'm Sarah Green Carmichael, politics editor with Bloomberg Opinion, and I'm here today with our health and pharma columnist, Lisa Jarvis, and our science columnist, Faye Flam, to talk about Robert F. Kennedy's Senate confirmation hearing yesterday for Secretary of Health and Human Services. We are going to deconstruct some of the key moments from the hearing and get into how this person might actually run this massive department if he is confirmed, which still is a serious possibility. So, as we kick off here, I'd like to talk about one of the moments that needs a little bit more attention. This is when Bill Cassidy, who's a Republican senator from Louisiana, who is in fact a medical doctor, has Kennedy some very open-ended questions about Medicaid and Medicare, and Kennedy could not answer them. So let's see that clip and then we'll react.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans, like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospital.
Okay, so Lisa, let's start with you. Maybe you could give us some context on that answer and also just remind us what exactly the Secretary of HHS is responsible for.
Yes, thank you, Sarah. So I thought that was a really important moment. I know that we, are going to talk a lot about vaccines and he gets a lot of attention on that front. But just to remind people, HHS is a big job. The agencies he's overseen include NIH, CDC, FDA, and, CMS, which is, overseeing Medicare and Medicaid. So in this moment, he basically has shown us that he doesn't fundamentally understand what those agencies do. It's a little scary because he was confusing Medicare and Medicaid. He repeatedly throughout the session yesterday talked about Medicaid premiums being too high, which, of course, most people who are on Medicaid, which is a huge chunk of Americans, don't pay premiums. That's the whole point. It's for people who are, in poverty or low income. And so I thought it was really revealing. This was a softball question. Today, Cassidy is going to be running the health confirmation, the health committee hearing. And so, I hope that tonight, Kennedy spent last night brushing up on some of these basic facts because, he's going to be responsible for America's health.
Yeah, it's a huge job with a huge budget. The budget of this department is roughly the size of the GDP of Australia, just for comparison's sake. So this man is going to be in charge of a lot. And he does have this troubling record on vaccines. He has gained a real following, sowing doubts about vaccines. And Faye, I'd like to know why you think he's been so influential on that issue, because, he's not a doctor.
He's not a doctor, but I think that the figure of a crusading environmental lawyer can be pretty compelling. And there have been stories of other crusading environmental lawyers who became heroes by fighting the chemical companies over pollution, over the Teflon. He chose the wrong battle. He went to battle for women who thought that their kids had autism because of vaccines. And study after study showed that was wrong, and he wouldn't get off of that. But, I'm also interested in some of the social forces that can kind of, propel some of these people to power. And I think that there is something going on. He appeals to conspiracy theorists, but there's also a big spectrum of people who are not full-blown conspiracy theorists, but I think are susceptible to kind of a paranoid narrative where they're willing to believe that all of their problems are due to this sort of nefarious activity in both government and private industry, that it's all these sort of hidden chemicals that are causing all of our problems. And I think that narrative is really big right now, and Kennedy is kind of riding that wave, and Donald Trump has ridden that wave to an extent too.
Yeah, it brings together a lot of different strands of sort of mistrust in the government and sort of further fans those flames. And some of those concerns, are justified. There are a lot of pollutants. We have not done a great job of keeping chemicals out of America's water. We've seen lead in Flint, Michigan, for example, that was incredibly hard to eradicate. But it also seems as if he has not necessarily been swayed by scientific papers that really ought to be reassuring to people where there is evidence. And I just want to read out a brief quote of what he said yesterday. Because he has moved from really suggesting conspiracy theories about vaccines to suggesting that the science isn't there. So yesterday he said, "Senator, I support vaccines. I support the childhood schedule. The only thing I want is good science." So that probably sounds reasonable to a lot of people. But Lisa, what is the problem with framing it that way?
Right. I think he's been very effective at sounding like I'm just asking questions and I want you to, show me the data. I mean, what he's doing is undermining years, decades of, scientific studies and epidemiological data, supporting the safety and efficacy of these vaccines. I mean, the vaccines we're talking about have been used in hundreds of millions, billions of people, right? And so he's trying to essentially just poke at that thread and make it seem like somehow the government isn't telling us something. Maybe that's the CDC that's, hiding something from us. Maybe it's the FDA. Maybe it's the pharma companies themselves. I think by sort of saying that he's pro safety, that really resonates with parents, I think that he's been very effective to Faye's point, early on when he kind of got on this bandwagon of the connection that has been debunked over and over again between autism and vaccination. He's really playing into parents' fears. They want to do the right thing for their child. And so it's easy to sort of sow that doubt within a parent that maybe I'm not doing the right thing by vaccinating my child. And he's done that over and over again in various areas. And I think what we should worry about is how that same approach and that thinking can apply, not just in vaccines, but across everything he's responsible. And it's a lot of our healthcare.
Yes, there was a moment yesterday when Maggie Hassan had like a stack of papers on mifepristone. And, Kennedy was saying, "I just want to see the science. What's the science?" And she was like, "Here it is," this big phone book of papers. And it just seems like there's something about constantly asking for more data when the data exists already that is not honest.
And that moment really worried me, Sarah, because, just for anyone in the audience who doesn't know, mifepristone is, one of two pills that you take for medication or abortion. At this point, it's responsible for over half of abortions in the US. And he said repeatedly that Trump is asking him to review the data on mifepristone. But you could imagine ways that he's going to use that data to undermine confidence in that. And potentially that could have really real consequences for access to abortion care in the US.
Yeah. And I think one point that you've made as well about just sowing some of these doubts about things we know are safe is that we are seeing shifts in vaccination rates. We are seeing fewer parents getting their kids vaccinated. We are seeing more parents who have doubts, and we're seeing a partisan divide on that. Republicans have become much more likely to be vaccine skeptical than Democrats, and that's not a good thing. But in addition to kind of sowing some of these doubts, there's also been some just crazy things that Kennedy has said. And we could hear a clip now, maybe from Senator Bennett confronting Kennedy with some of his conspiracy theories that he's helped spread about COVID.
Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that.
I'll take that as a yes. I have to move on, I have to move on.
Okay, Faye, help us understand what we just saw there. What was that all about?
Well, I actually listened to the entire episode of the Joe Rogan Experience podcast where that exchange took place. And I think that was actually one of the few cases where he was being a little bit misquoted. I think it is, if you listen to the whole exchange, he was saying something to the effect that COVID has a higher death rate in some ethnic groups than others, and people have studied that, and it's a real thing. And I think he used the word targeted. I don't think he necessarily meant it that way. I sometimes think that gives fuel to his supporters, that they say, look, they're being so unfair to him. They're trying to frame him as a racist. And I don't think that I didn't come away from that show thinking he was a racist. I came away thinking that he was spreading a lot of misinformation about the COVID vaccines. There were sort of 100 other things he was saying that were incredibly misleading. And I think that was a little bit of a red herring, because I think he might have actually meant what he said he meant, that it was it was about the disease actually having a disproportionate effect. He was talking also about germ weapons and how we shouldn't support any research that is dual use and could be used to make germ weapons. It was.
I have a question about that, because why would he not then take this opportunity at a Senate hearing to say, look, I was misquoted. Really, there was this NIH study, and this is what the study said, and my words were twisted. And instead, he just seems to imply that there is an NIH study out there that confirms this weird idea that COVID is a targeted bioweapon against these racial groups. Why not clarify?
He should have clarified, but it was, he didn't, he was getting interrupted. He was not given a lot of chance. I think he was kind of cornered with that. And I'm not sure. I just don't think that focusing on racism is, I think it's not the real problem with him.
I have to imagine too that he said so many things that one could pull out, and there were so many things he needed to be prepared on to respond to. He might not even remember what he meant by that. It makes me wonder if he even remembered which of the many things, are based in actual science and which he's bended the science to fit his narrative, which is a lot. There's infinite, as we all know, and yesterday we heard so much of it. There are infinite opportunities to find, things that he said that are problematic when it comes to vaccines or any other number of topics related to health specifically.
Yeah. And I think, it's saying that developing technology that could be used for germ weapons is a problem. That's a reasonable thing. There were little islands of stuff that wasn't crazy in a whole sea of crazy during that podcast. And that's why I think, people sort of pulled that out, because it sounded like he was saying something even crazier than the rest of it.
Well, and I think precision is important, for someone in a public facing role, precision of language. Not that you can, the point is not to play gotcha journalism and jump all over people, but also to not imply that the NIH has made some massive discovery about COVID's origins that has somehow been hushed up, because as Faye has written many times, there's still a lot we don't know about COVID's origins. So it might be a mistake to come down too firmly on any side of that debate. But clearly it is not a racially targeted bioweapon, to be clear. I would like to ask a little bit more about sort of pandemic preparedness, because this is something, you both extensively covered the COVID pandemic. I know you are watching the bird flu outbreak very closely, both of you. This bird flu outbreak has laid waste to wild bird populations. It has been moving through domestic livestock. It has been cropping up in people. And there's a lot here to be concerned about. So, Lisa, do you think that RFK Jr. is qualified to prevent a future pandemic in the US, or to manage one if it breaks out?
I mean, I have to say, no. It worries me profoundly that something could happen that requires the type of thoughtful response, careful response, efficient and quick response that would make bird flu get worse. I think his track record on questioning COVID science, really spreading misinformation on COVID, what some might say disinformation on COVID, should alarm us. And then his questioning of COVID vaccines. I mean, we heard just in the past few weeks that is like 6 months into the rollout of the COVID vaccines, he petitioned the FDA to ask for them to rescind that approval. We know that those vaccines saved, I think the estimate is 3 million lives in the first 2 years of their rollout. So, he's questioned mRNA. I just would worry about the way that he would assess the data, and just to remind people, he pushed remedies. We talk a lot about vaccines, but he pushed things like ivermectin and hydrochloroquine, at a time when those were shown to not be helpful, so he's offering people things that essentially in the end become snake oil. So I think all of those are reasons to worry. And then I think just the coordination and response. Already we've seen this communications freeze coming out of health agencies, and it's making it difficult to understand completely what's going on at any given time. And so, that is meant to be temporary. If he were confirmed, I'd be interested to understand how that coordination and communication unfolds, because that's essential for local public health agencies to understand what's going on everywhere and to have coordination between all of those agencies.
Yeah, Faye, I know you also have been really closely tracking the bird flu outbreak. And what are some of your biggest concerns, and what might a future HHS secretary, what should that person be doing to prevent greater danger to the public?
Well, I think not pausing infectious disease research. I think that it's just a crazy time to say we should put a pause on infectious disease research and focus on chronic disease. I understand what he's saying about the burden of chronic disease, but they can't really be disconnected. Infectious disease can sometimes cause chronic disease. Chronic disease can affect people's susceptibility. That to say we're going to put a pause on this of all times right now when we really need more research, more understanding, and more surveillance of the human workers who've been exposed to infected animals, more surveillance on farms. Right now, we have this really scary situation where huge numbers of migratory waterfowl, geese, and ducks are infected, and it's the cow outbreak was scary, but this virus has actually really exploded into new animal populations in the last couple of years in a way that I think people haven't appreciated.
Yeah, and I think, Lisa, you've been very critical in the past of the Biden administration for not moving more quickly. And is there something here that you think should really be a priority for Kennedy, or if he is defeated, whoever would be nominated in his place?
I think, as Faye pointed out, we worry about the outbreak in cows, which maybe seems like it's quieting down. It's hard to tell, to be honest with you, but that testing is finally, I think my critique was largely about how slow-footed we were to actually understand the scope of the outbreak and what was happening to allow it to spread. I think she makes a good point that there's a high percentage of migrating waterfowl that are going to be infected with this in the next year with this virus. And the cases we're seeing in humans so far that have been the most serious, that is the source. It hasn't been, from people who are, dairy or poultry workers, which is also alarming and puts a lot of virus into the air. And we're in flu season. And I'll just mention it's scary because if you get the flu and you get bird flu at the same time, that gives the virus an opportunity to, mix, assort, and become something more dangerous. But I do think, there needs to be better communication, because that has been very difficult to understand how quickly things are moving. I just to go back to COVID, I think to just underscore that when that started to become clear, the scope of what we were dealing with, all of the agencies he oversees, it's not just, project, it's not just Operation Warp Speed, like quickly develop a vaccine, which was an incredible monumental effort. And we should be giving Trump credit for that, but it's also NIH researchers who were filtering through all the drugs that were on the market already to see if anything could work. It was NIH researchers coordinating with government around the globe to understand how the virus was spreading. I think there's just like a massive, it was trying to make sure changing rules with Medicare so that, seniors and others could use telehealth when they couldn't go into their doctor's office. There are so many aspects of this that he needs to be responsible for, or just over managing. And it's worrisome that, none of that might unfold in that same way, which, we know that there were already problems with how we did it with COVID. It could get much worse.
Yeah. So I'd like to shift gears slightly and talk about his stance on reproductive rights, because this is something where the Trump administration has not been really clear about what their priorities here are, and where RFK has sort of disavowed his previous pro-choice positions and said that whatever the new Trump plan is, he will support that. So we've got a clip for that as well from Senator Hassan. Let's watch.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
So, Lisa, what could he do as HHS secretary should Trump ask?
Yeah, I think there are a few things, but maybe we'll just start with mifepristone, which we talked about earlier. This is, part of the regimen for medication abortion. And, there's a lot of lawsuits flying around right now that, could impact that. But one thing that he could do within his own job is that in recent years, the FDA has loosened the barriers essentially to accessing mifepristone, which had been very high for many years. And so that's enabled things like telehealth visits and mail order, dispensing of the drug. So straight off the bat, he could just restore those restrictions, which is something that anti-abortion groups have been, asking for. I mean, they would like to see this drug not available at all, but because it has made it possible for women to access abortion care who live in states where bans exist. If you were to do that, it wouldn't just affect women living in those states. There's a lot of talk about how, from the Trump administration that we're just leaving it up to the states, but doing something like that would affect women who live in states where abortion is legal. I live in Illinois. We're considered a haven state, but if he were to do that, that would affect so many women living in this state too. If you're in a rural area, now you have to try to go to a doctor's office and get the pill dispensed in person. It also would change some things like how long into the pregnancy that could be used. So I think one thing that concerns me, again, going back to his way of sort of using data to fit whatever narrative he's pushing, and in this case, it could be whatever narrative President Trump decides he wants to use around mifepristone. He says he's going to analyze the safety of the drug. He's going to task the agencies with that. Well, yesterday he talked about, for example, the label itself says that 3 to 5% of women who take this go to the emergency room. Well, that does not mean it's not safe. A lot of women go because they want to understand their abortion is complete. A lot of women go just because they don't know what the process is going to be like, and they want to make sure they're doing okay. It's not because something has gone wrong. And so I think there's a lot of ways you could easily use the data to justify, guiding the FDA to roll back those restrictions.
Mm-hmm, mm-hmm. Faye, what are some of your concerns here around reproductive rights?
Yeah, I mean, I think that when you initially said stance, I thought you said his dance on reproductive rights, and he was kind of making a little dance out of it, and I think it shows a really deep problem with integrity. That I just think that was really the core of what the senators were concerned about, is that he doesn't have that kind of integrity, or that would have somebody stick to any kind of core values. And, that's a common issue with politicians, that they sometimes lack integrity. They'll be accused of flip-flopping. And I think when, there are times when people legitimately flip-flop because there's new evidence, and scientists are sometimes accused of it because they change their minds in light of new evidence. But there's also flip-flopping that indicates a really deep lack of integrity. And I think that's what some of the Democratic senators were getting at here.
Yeah, and I'll just add to that. I think there's also a lack of knowledge. I mean, even his pro-choice positions were not terribly informed. He once said he would support abortion on demand, even at full term, which is 39 weeks. And that's not a thing. You do not
what full term meant. Yeah.
He either doesn't really understand how pregnancy works, or, he doesn't understand that if a woman at 39 weeks requires an emergency delivery, they will deliver the baby. Like, that would be the standard of care. So there's a lack of integrity, and also maybe a lack of knowledge there.
I think, going back to the lack of integrity, it's pervasive. This is on vaccines. The first clip we saw of Elizabeth Warren questioning him. Did we see that clip? I don't know. But yesterday she questioned him about his ties to lawsuits that he would be enriched essentially by suing vaccine manufacturers. And some of those are ongoing. I think we also have to question, there was some reporting yesterday from the Washington Post that he trademarked MAHA, Make America Healthy Again, and then, cordoned that off to one of his allies so that he could make money off of it once he's in a government role. So, when we talk about integrity, I think we also have to ask, what are his motives ultimately? What it seems like he's willing to change his position if it ultimately benefits him financially.
I want to circle back and close on this problem of medical misinformation, because I think that we would not have seen the ascent of this person if there were not some deep-seated concerns in the public that makes his skepticism seem reasonable. So, Faye, let's start with you. Because you've written extensively about medical misinformation. You got a Pulliam Fellowship to study medical misinformation. How has it become so widespread to kind of accept that there must be some sort of something wrong, some deep conspiracy around American medicine? And what do you think needs to happen in order to pull back from that?
Yeah, I think there are a couple of kind of intertwined things going on. There's a famous essay that I linked to in my latest column called The Paranoid Style in American Politics, and it's by a historian named Richard Hofstadter. And it's really about ways that in American history there have been these sort of movements, paranoid movements, where people demonized some group or something. And I think that there's that can be very compelling and kind of snowball, and that we're seeing that. We saw that during COVID. We saw that with, we saw that with the narrative that vaccines cause autism. And we saw that with ivermectin, which has sort of, has this kind of bizarre appeal that just won't die. I think we also have a proliferation of bad science. And I was talking to a scientist yesterday who has been studying scientific integrity. And I said, is this really a proliferation of pseudoscience that just looks a lot like real science? And he said, yes, we're seeing, journals, we're seeing something called paper mills, where there are these sort of fake studies. So there's a bad study that somebody like RFK Jr. can point to back just about anything. And I think that makes it confusing. I think that scientists have the critical thinking skills to know how to sort the good and the bad, and that a person that's in a position like his wouldn't necessarily have to have a science background, but it should be someone who knows how to get good advice from scientists then. And the problem with RFK Jr. is he doesn't know what he doesn't know, or, he pretends to know what he doesn't know. So he wouldn't just say, well, I'm not sure on the details of that, but I have these really good advisors who are going to help me. So we have this kind of proliferation of bad pseudoscience that looks like science. And then I think we also have a social media atmosphere that promotes outrage, not over reality. And so, what sells is what makes people get angry and up in arms and feel outraged at a specific target, not necessarily a kind of balanced, nuanced, rational discussion. That's not what rises to the top in social media algorithms.
And something that you wrote about once that has really stayed with me, because I'm one of these people who does late night panic Googles about health symptom, which is such a terrible idea. But Faye, you wrote a column about how sometimes doing your own research really can lead you down a misinformation rabbit hole. And that is so true. And it's just, I think there's a sense that there's so much information out there. The real answer must exist. Don't be a sheep, do your own research, but that can really lead people astray.
It can, especially because Google doesn't necessarily focus on the credibility of the sources, and so sometimes the most alarming information goes up to the top instead of, the Cleveland Clinic's version of it. And so I think people can get led further and further. And also because of the way that people tend to search on Google, they'll look for confirmation of the thing they already believe, as opposed to looking for refutation. How could I be wrong? And so that's something that, in good practice in science, people do. They try to prove themselves wrong, but that's not the way that most people think, and it's not the way certain environmental lawyers think either.
I think I was just going to say that, when it comes to turning it around, looking past the Google search, people really do. The data show that parents trust their pediatricians most when it comes to issues like vaccination. And so finding ways, evidence-backed ways, and they exist, although I have a feeling they're probably going to need to shift strategies a little bit and do some more research on what is most effective. But pediatricians we know what the best way is for them to deliver the message that vaccines are safe for their kids. And so that work is going to happen on the ground up. And I think probably outbreaks are going to happen. And we've seen in the past that when an outbreak happens, people retract from those positions and they get their kids vaccinated.
Yeah. And I think, Lisa, to your point, I think giving pediatricians and primary care providers the time to have those conversations probably does require some kind of medical system reform, because you can't do it if you're churning through new patients every 15 minutes,
No. And it's not the AI nurses that RFK was suggesting yesterday is going to save us. So
yes. No. Well, thank you both for joining us today to talk this through, and we'll be watching to see what happens next. See you soon.
All right.